Hi, I'm Dave Fornell, the editor of Imaging Technology News Magazine. I'm here at RSNA 2015 in Chicago. And I have with me Lori Webb. She's a registered radiology technologist and a clinical analyst for MD Buyline. I want to talk to you a little about some of the trends in general radiology and also with DR especially, and what you're seeing here on the show floor and some of the trends in the market.
Perfect. All right. Well, this year I see a high degree of focus on automated systems. This year we have seen some vendors that have actually taken it all the way to robotics. It's a great way for radiology directors to improve their workflow, efficiency. Everyone's concerned about time and trying to shave even off minutes and seconds off those exams.
And how about technologies to help cut down on retakes?
Well, with all the new improved software capabilities, such as gridless software that a lot of the vendors like Philips, Fuji, Konica have, they're able to really not have to worry about the alignment issues that were kind of a problem with previous generation systems, where they've got software now that can take care of all that.
There's one of the late breaker trials that they have today at RSNA is actually a gaming technology using the Microsoft Kinetic, where they have that set up in front of a DR plate in a room where they could actually track the motion of a patient. If they have an arm out of place or they're kind of sloping off to one side, it'll actually detect and give either a green light or a red light whether they could shoot it or not to try to cut down on the number of retakes, especially with inexperienced techs.
Absolutely, yeah. Positioning is a really big challenge for a lot of today's technologists, and anything that they can help that's going to make their life a little easier. It's going to make a happy technologist, which is actually going to translate eventually into patient satisfaction, which is where things are right now too.
And what are some of the developments in DR? DR has become a relatively mature technology over the last couple of years, but what are you seeing at the show that's new or may push DR forward a little bit?
Well, we continue to see plates that are a little lighter, that have longer battery life, which is kind of a big issue. More and more focus on integration of systems rather than just retrofits. Of course, that's still a very popular field within DR. However, as panels become to get lighter, they also want to have a concern about the actual IPX rating or the water resistance. It's another big factor.
And what about size of plates? I've seen pediatric plates are a big deal last year. This year, I think there's a couple oversized plates for full body runoff.
Yeah, obviously the 14 by 17s came out first, and then 11 by 14 followed by 10 by 12, and then the 17 by 17s have been out as well. We're actually starting to see a little bit more use of those within the portable imaging market as well, so that for oversized patients, and that way they have a little bit more latitude in the imaging field.
And how about with the mobile units? There have been a couple of releases. I know AGFA had one earlier this year, and CareStream's had improvements with their systems, as have other vendors on the floor. Have you seen any improvements with the mobility or the size of these systems or other factors that could help with streamlined workflow or even maneuvering it around?
That's a very hot topic. For a while there, we really only had one vendor that had the collapsible telescoping column. Now we have several vendors that have joined into that arena. It's really going to kind of shake things up a little bit. It's going to give the customers at the hospital a lot more to choose from. It's really been a big hit as far as patient safety, maneuverability, being able to kind of squeeze into those tight spaces in the patient's room and be able to kind of see where the tubes and lines are, where the IV poles are, the ventilators. So that's going to be a great asset to the technologists of today.
And what about software enhancements? There was a big deal a couple of years ago about bone suppression software for DR. Have you seen other things like that or enhancements for the DR images themselves?
Absolutely. This is one of the first years where we have seen the availability to have tomosynthesis, digital subtraction, as well as auto stitching available on fixed X-ray units. Before, some of those advanced applications were only available on fluoro units, but now they have the capability of having those actually on an X-ray system.
And let's segue to fluoro units with RF technology. There have been some new systems that were released over the last 12 months. What have you seen on the show floor, and what's new?
Well, as far as fluoro, we still have that little bit of a bifurcated market altogether. People are still interested in the image intensifiers. That technology is still very valid. The price point obviously is a little bit better than the dynamic panel systems. However, that's where the gold standard is. We have folks like CareStream that have entered the market that didn't have that offering before. Within the fluoro market, it's kind of interesting. One of the niche aspects of this market was the multi-purpose room, where Siemens has a system as well as Toshiba. But this year, Toshiba has introduced a new, smaller footprint system that has a dynamic detector with that. And we've started to kind of see a resurgence of interest within that market, because folks are kind of looking for that room to kind of make their dollars stretch a little bit more to be able to do some of that overflow angio. And
I think the Toshiba system also has a tilt feature too, where they can do. What else are you seeing in the market? You mentioned mobile, you had mentioned DR. Are there any big advancements that the vendors are talking about for the next couple of years moving forward?
Well, they're trying to just even streamline some of the systems just to even a small degree to make life a little easier for technologists. LED lighting within the collimator so they don't have to change the bulbs out quite so often. Maneuverability within some of the mobile X-ray units. One big thing that comes with the auto positioning and the automation of the systems is it's easier on the shoulders for the technologist and their workflow. There's kind of a fine line. As a technologist myself, I still want to have some independence within that. I still want to be able to change up my positioning and my workflow if I want, but I do realize that it is a real time saver when I could be more efficient when the system is moving into different positions when I need it to, kind of predicting.
And with your experience as a technologist, you're on the floor, you're in a position to where most technologists are not. You get to see the stuff firsthand.
Yeah.
If you were given carte blanche to go off for your hospital system and buy a system, what are the key things that people really should be looking at in these systems or should be asking these vendors?
Well, first and foremost, kind of take a look at what you have already in your install base. There is a real advantage when it comes to training and familiarity with the user interface. If you have had a vendor or multiple vendors within your hospital that you're comfortable with, being able to swap out panels and really maximize the advantage of detector sharing. If you've got a heavier workflow with your mobiles in the morning and you need to kind of float a couple panels around, but yet use that in a different capacity, maybe a fixed system in the afternoon, that has a real advantage.
What about workflow efficiencies with the systems themselves?
Well, with the automation, you're obviously able to kind of get away with less FTEs when you do have the machines doing more of the actual physical movement itself. And in addition, some of the post-processing availability that it's today with the gridless software, as well as the RIS integrated work lists, even on our portables, that makes life a lot easier. A lot of the vendors are kind of beefing up their connectivity on their mobiles, so you don't have as many issues with those dead spots within the hospital as we used to.
And what about the panels themselves? These are very expensive. They could be 80 to 100,000. What questions should people be asking about the panels themselves?
Well, they want to be able to try to pick out a panel that their technologists are going to feel comfortable with. There's a lot of versions out there on the floor today, and the last couple of days that I've seen that actually have built-in little rubber grip mechanisms that will make it a little easier to carry around, a lot less apt to drop. Some of them have built-in handles, and then those that don't often have a third-party way to provide a carrying device so that it's a lot less risk to drop.
And are most of the vendors today providing some sort of an insurance plan for these things?
They do. Actually, the industry's been really surprised over the years. We kind of thought when we moved from CR to DR that we were going to have a lot more oopsie drops, but the industry as a whole has been really proud of the technologists. They've really taken this technology and these advances very serious, and they've really embraced the new technology, and they've been pretty careful with them. It's amazing that most of the surprise insurance claims and service claims have actually been related to liquid damage versus drops. Yes.
Great. Well, I appreciate your expertise today. Thank you.
I appreciate it.